Imagine lying down on a cold wooden table, completely awake, feeling every single slice and pull, with nothing more than a sip of whiskey and a leather strap to bite down on. Sounds horrible, right? Well, welcome to surgery in the pre-anesthesia era, where your ancestors went through unimaginable pain just to survive another day. Today, surgery means sterilized rooms, trained professionals, and most importantly, being totally knocked out by anesthesia. But rewind a few hundred years, and surgery was more of a gruesome guessing game. Imagine doctors who washed their hands less often than you check Instagram, instruments that hadn't seen soap since they were made, and a surgical theater that looked more like a butcher's shop. Back then, surgeries were done fully awake. If you needed an arm amputated, you'd better be tough enough to watch it happen. Patients were restrained, sometimes by ropes or held down by assistants, while the surgeon sawed away as quickly as possible. Speed mattered, not for your comfort, but because the faster the surgery, the higher your chances of survival. One of the most dreaded procedures was bladder stone removal. The surgeon, using nothing but a curved metal tool, would slice directly into your bladder through a very sensitive area. Patients would scream, thrash, or pass out from sheer pain. If you survived the surgery itself, infections afterward could still finish the job. And don't forget trepanation, drilling holes in the skull to relieve headaches. Yes, actual holes drilled slowly by hand. Patients often felt every agonizing turn. And here's something wild. Your surgeon might have also been your local barber. That's right, the guy who cut your hair would happily remove your appendix too. Barbers doubled as surgeons because their razor skills were considered transferable to medical procedures. Comforting, right? Before anesthesia, pain management was pathetic. The best you could hope for was alcohol, opium, or having your nerves temporarily numbed by ice. Mostly, you just had to endure, bite down on something, and hope the surgeon was swift. Dr. Robert Liston, a 19th century surgeon famous for his speed, could amputate a limb in under 30 seconds. However, his speed came with errors. Once, he accidentally amputated his assistant's fingers during surgery. Both the patient and assistant later died from infections, making it possibly the only surgery in history with a 300% mortality rate. The patient, assistant, and a spectator all died. Finally, in the mid-1800s, humanity was blessed by the discovery of anesthesia. Ether and chloroform revolutionized surgery, ending centuries of unimaginable agony. Patients no longer had to witness their own surgeries, and surgeons finally had time to perform carefully and hygienically. So next time you're dreading that trip to the dentist or minor outpatient surgery, just remember, you could have been born a few centuries earlier. You'll quickly realize how lucky you really are. Take a deep breath, enjoy that anesthesia, and be thankful your doctor isn't also your barber.